the CEO performance and search committee meeting. I had to think for a minute of what capacity we're here, but we are here as the CEO search committee, and pleased that everybody could make it. As always, there is lunch for members of the committee and the public and visitors, and so please feel free while we're meeting or afterwards to eat. We'll start on our agenda with the conflict of interest. If any of the members of the committee have a conflict of interest they need to announce with today's business, please do so now. Okay, if not, Dr. Nettles, would you read the hospital's mission statement, please?
Gladly. To improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Thank you, Dr. Nettles. Ms. Lester, is there any public comment before we start our business?
None.
Thank you. You received minutes of our previous meeting on February 4th, and they are part of the written materials you have in front of you. Does anyone have any corrections or edits that they want to suggest to the minutes before we vote?
Move to approve.
There's a motion. Is there a second?
Second.
Great. Thank you, Dr. Martin. There's a motion and a second. Any discussion? If not, all those in favor of approving our previous meeting minutes say aye. Aye. Any opposed? The minutes are approved. That takes us to our new business, and we have our friends from B.E. Smith AMN Healthcare Consulting to update us. Generally, our agenda is today to get an overview of the most recent work and developments in the search process from Mick and Julia and their team, and then secondly, to go through and finalize the job description, the prospectus, and the ad that we have been working on, and then finally go through the proposed timeline that AMN sent us since our last meeting. So with that, I will turn it over to Mick and Julie to start with the overview.
Very good. Thank you, David. This is Mick. I want to make sure we go through some of the, I don't want to go through edits on the prospectus, but more discussion about some of the edits on the prospectus to make sure that we're representing the organization as you guys expect us to. The timeline, what I would ask from the group is to take a look and make sure there's no major conflicts. I don't know that we have to tighten up or shore up the timeline today versus provide you with the timeline to make sure that if there are conflicts, we can be informed about those in advance and make adjustments to those timelines. So I don't know how much we want to get into that discussion today versus an overview. And if there's any immediate or overarching concerns, adjust to it. But I don't want to chase calendars today in the time that we do have, if that works for everybody.
Yes, that sounds fine.
And Julie, anything else to add?
Nothing to the timeline, but I could definitely add some context around some of the discussion points with the documents.
Let's get into that if you want to go ahead and get started.
Let's get into it. Well, hello, everybody. Thank you very much for the feedback, the edits that some shared with us. They were very helpful. With that, just wanted to get some clarification on preferred wording that we should use consistently throughout the documents. The first one is thoughts around safety net or essential hospital.
Do you prefer safety net or essential hospital?
Essential?
Essential or safety net?
Okay.
Which do you prefer?
Dr. Martin?
My understanding is that we are a safety net hospital, and that essential hospital term has to do with an organization of hospitals with a slightly different emphasis. but I think we qualify and operate as a safety net hospital, and I suggested that that edit, but I'm open to discussion about it. Dr. Webb was very fond of the word essential, and I believe we are members of that organization.
I don't have any view or knowledge about that. I would defer to you and others who have more knowledge about, how the proper terminology for our hospital, and also AMN, if you all have a view as to those. But safety net is how I've always understood and actually used it when talking about the hospital, so that makes sense to me. But if others have thoughts, we should clear that up.
I can give a very clear kind of the definition between the two. The safety net hospital is any hospital, public or private, that provides care regardless of ability to pay, and has a disproportionately high share of Medicaid and uninsured low-income patients. But there's the other one, the essential, which I think is, I feel would be more attractive to potential CEO candidates. But that is a subset of safety net hospitals, but it's one where it's typically urban hospitals that serve not just large Medicaid uninsured populations, but also provide services that nobody else does. So whether that is trauma, psychiatric, community level programs. So that's the difference. I think when people would take a look at that, we had a discussion where, again, I think that essential is more attractive to potential candidates. Ms. Hisham, do you have any thoughts around that?
Yeah, I guess, and this is Mick. My only thoughts are that might present better as we market the position, but I'd also want to make sure it accurately depicts the position, right? So, or the organization. So that's the reason for the question today.
This is Christy Smith. I appreciate the opportunity to speak. I was at the THA event yesterday, Legislative Day on the Hill, and actually this conversation came up, so I just thought this would be helpful. I think there can be a perception that a safety net hospital, there's some negative connotation around that, at least what I've kind of heard, or it depicts a specific audience. And I think especially as we consider what I deem the rebrand of Nashville General Hospital going forward and what the growth opportunities can and should be, I think if legally accurate and comfortable with our organization, I'll also like Essential Hospital better than Safety Net, because I think it gives you a greater growth opportunity and a more diverse perspective with regard to the types of clientele that we may want to have, especially as looking at potentially other partnerships going forward.
I think this is a very cogent argument, and would be happy with going with the term essential.
Any other members of the committee feel one way or the other about that, or are we in agreement that essential is both accurate and advantageous to us when we're talking about the position with candidates? Okay, so Julie, in the room, we have everybody nodding their head, so I think to the extent you need to revise and make that uniform, we're comfortable and prefer describing it as an essential rather than safety net.
Wonderful. We will make that change so it's consistent then through all of the documents. The second was the terms strategic plan or 5-year strategic plan, which were used throughout the documents. Is there a preference to how you would like that depicted?
Dr. Nettles?
My question is specifically, so really what does that mean, or what are you suggesting? That's probably one and the same.
Well, I guess it sounds like there are different references in these materials that we put together. Some talk about strategic plan generically. Some talk about the 5-year strategic plan, which I think refers to a specific plan that is in place. I'll speak first, and you know, everyone should weigh in. I think that my preference would be to generically refer to a strategic plan, because I think that the next CEO is going to be tasked with evaluating what the current strategy is and rethinking it going forward. And any organization, you know, on a 5-year basis makes sense to revisit the strategic plan. So in talking generically, or in this type of document, I wouldn't want a potential candidate to think there's a specific plan and we are in year 1 and your job is to follow through on it, because my sense is that is not where the organization is or where the board is, that we are open to and would expect some real thought given to what the long-term strategy is for the organization.
Well, I think you've said exactly what I was trying to articulate in my head. So thank you.
Any other thoughts about that?
I don't think we need to limit it to 5-year.
Okay, so Julie, I think there's a consensus again that where we may reference the strategic plan or a particular strategic plan, that we would prefer to generally refer to a strategic plan, leaving open the expectation that this is part of the new CEO's task and opportunity, which is to engage in strategic planning.
We will make that change to the strategic plan. And also that in the job description, under job performance and expectations on number 1, it says strategic plan is a, quote, living document that's reviewed yearly with the necessary adjustments as part of the evolving process. I had some feedback that says that piece of it, of describing what it was, wasn't needed, and leaving it just as participates with board, medical staff, and senior management in the development and implementation of a strategic plan. So do you feel that you would like it to read as a strategic plan is a, quote, living document, or go without that?
I'd go without that. Make it simple.
Okay. I agree. Okay. And then the last one, it says, reporting to board of directors or hospital authority. It was used both ways throughout, and the feedback was a preference for one or the other. What does the committee overall prefer?
Well, I think the name of the body is the Hospital Authority Board, not the Board of Directors.
Okay, Julie, everybody's nodding their head. So that is the name of the body, and so we should make that consistent throughout.
According to Hospital Authority. Oh.
The Hospital Authority Board is a longer name than that, but Hospital Authority Board are the first 3 words.
All right. We will make that change consistent throughout. There were only 2 others. Again, this one would be in the prospectus. I'm sorry, it would be, in the prospectus, under the job description, under number 2, it says establishes and attains patient care, safety, education, and community service goals while pursuing financial viability. Introduces population health, PCMH, and the chronic care model, and NCQA quality standards to use data to drive decision-making processes. That's the first. The second one was continuation of that, where it has host town hall meetings to assess community engagement for facility access and services, and develop community outreach initiatives based upon this information. Continuously promote community health fairs and learning education forums for community engagement and input.
Yeah, I think that we can strike that. I think that to hold the CEO to having regular meetings with the community or having health fairs, I just wouldn't put that in there.
Great. We will remove that. I agree with it, keeping it clear and concise. The other one is number 7. As it reads, it collaborates with Meharry Medical College and medical staff in relation to the teaching and academic medical center environment. The other option was establishes and maintains communications and relations with the medical staff, collaborates with medical staff in relation to the teaching and academic medical center environment. And then it has meets with physicians and service lines monthly to go over issues, concerns, challenges, direction, and to engage in dialogue around strategic plan and access to care. Meets quarterly with the medical staff to give updates from leadership and seek input on processes and strategic focus on recruitment of primary care physicians and select physicians to broaden the hospital's ability to offer appropriate care to the patient base in coordination with Meharry Medical College, building a critical physician infrastructure.
We took
I feel like it's pretty wordy.
I think so. I will suggest that the existing paragraph 7 is at the appropriate level of generality, which is an expectation of collaboration with Meharry and the medical staff, and keeping front of mind that this is a teaching and academic medical center environment. The rest of what you read about monthly meetings with service line heads, quarterly meetings, is too prescriptive. And I think in general,
Right.
my comments and many of the committee's comments and deletions were, this is a document that sets forth, it should set forth very broad expectations, and it should not prescribe a monthly anything. Like that's way too detailed. It would be up to the CEO to determine the frequency and the forums in which they would do that. But the expectation is, of course, that the CEO will work closely with Meharry in keeping with the fact that we are in an academic medical center environment.
I'd like to add just one word to that statement where it would say Meharry Medical College and faculty and staff. I'd like to insert faculty in there.
So, Julie, that's in paragraph 7. Do you see that?
It is on the job description, number 7.
Correct. The expectations under the job description, Meharry Medical College, faculty, and medical staff.
Medical staff. Right.
Yes.
May I ask a question? So, again, just being thoughtful about future endeavors and relationships that we may be collaborating on, should that say, and obviously Meharry is our primary partner, but should it say, or other affiliated, third-party hospital affiliates, or should it be, I think, or some type of healthcare relationships, because I guess we do have some relationships, as an example, with Vanderbilt. So I just, instead of naming them all, maybe we put Meharry and some other language that would describe and leave open those opportunities.
Other appropriate partner affiliations, however that we might want to state that.
Yeah, I mean, I would say I thought that we had said that elsewhere, but maybe not. But I mean, I think that the one thing that we want to do going forward is that we want to improve our relationships with everybody in the community, anybody that can contribute to the organization.
So can there be an extra line, an additional bullet point that says, institutional relationships within, because we're going to be doing research projects and things all over, so.
Yes, Dr. Martin.
You could change the wording to collaborates with faculty and medical staff of Meharry Medical College and other affiliated institutions in relation to the teaching and academic medical center environment.
Yeah, I think it's important to name Meharry in particular, but it's also important that we are, because this is, again, a general document, that we understand that there are other institutions that we would like to have closer relationships with than we have in the past. Is that sufficient? Julie, do you get that? Because, so one thing is we're talking about paragraph 7 within the job description, job expectations. As I'm kind of looking through the ad and the prospectus, I think similar language, you could make a similar change to that same concept in those other documents.
Yes, you certainly can. So can you read what the agreed upon verbiage is? I have collaborates with faculty, medical staff of Meharry Medical College, and something else in relation to the teaching and academic medical center environment.
Collaborates with faculty and medical staff of Meharry Medical College and other affiliated institutions in relation to the teaching and academic medical center environment.
Thank you.
Let me say, in the interest of, it's engaging stakeholders, Dr. Southpaw is here and attends all of our meetings, which I'm very grateful for. And since we've had an extended discussion about Meharry Medical College and other, I invite your view on, or if you want to speak to the committee about, how it is that we describe for potential applicants to this position. Come sit here. And I'm sorry to put you on the spot, but I feel like we're talking about your institution and you're here and would love to hear your thoughts on how we describe this.
Thanks for the opportunity to comment. As someone who's been in a number of different institutions, the best patient care is provided by the best team, which is going to be those that collaborate the best. And that's undoubtedly often going to involve grabbing folks from here, there, or wherever. And so I think that the whole idea of whomever is willing to work with the essential hospital provides the essential environment for the community. It's interesting as you come through the airport, you see Vanderbilt talking about most heart transplants. You see Meharry talking about what everybody, we're all sort of jockeying to get some face time, and it's because we have different strengths. And so I think the best city hospital, essential hospital, is the one that has the most collaborators.
Great. Thank you for giving us that input, and I think we share that idea, and that's what we're trying to reflect, Julie, in this. Dr. Martin?
Yes, before we leave the CEO job description on the very first paragraph, thank you for unpacking that very long sentence with bullet points. The last one, I think, the last one should use the word ensuring rather than ensure, just to be consistent with the bullet points. The copy I have starts ensure optimal fulfillment.
Julie, we're now at the top of the job description.
Correct.
Yeah, you
the
got
last
it.
bullet. Okay. Thank you.
It's CEO job description. We were looking at the job performance expectations, which is that numbered list. It's towards the end of the packet. But the top of the job description gives some broad bullet point categories of responsibility.
Change noted on from insure to insuring.
Yes.
And then the last was number 10 on the job description. It reads, ensures that the community and charity programs, parentheses, uninsured, are appropriately determined and effectively administered as the safety net community hospital, which we will change as essential for the region. Maintains the patient-centered medical home, disease management model, and ambulatory clinic setting to reduce unnecessary emergency room visits and give the patient a systematic approach to coordination of care and maintains a food pharmacy program for patients to obtain appropriate foods for their specific medical needs. The edit suggestion was to using everything, it was remove everything after the maintains. So keeping it as is ensures the community and charity programs, parentheses uninsured, are appropriately determined and effectively administered as the essential community hospital for the region.
I will speak to that because maybe others made this suggestion, but I did, and it's the same premise as before, which is the last two sentences of that to mean read very specific and prescriptive. I think the food pharmacy is a fabulous program and very beneficial, and we're proud of it. But to elevate that one program over every other service that the hospital does, which is so varied, is not really appropriate in a document like this.
I agree.
And I think less is best, but also it allows an opportunity for creative thinking and also collaborative thing, just a new vision, a new thing. So.
Okay, Julie, so I think that the committee agrees that we leave the first sentence, but then omit the other two.
Noted, and will change.
And if that's the last change there, I did have a sort of a general comment and be interested in the committee's views. Was I read these three documents, particularly thinking about the prospectus versus the job description, it is certainly important to have a job description. I think it conveys information that will be useful to the candidates. If I were leading and trying to give one document to an applicant or someone interested in this position, I think I would lead with the prospectus, the way that document sets out the context for this search and what this role is and what the expectations are. So I see the need for both, but I wanted to say and invite comment about, what do we think what's the document that we would most want someone to look at to understand what this position is about?
I guess my other question, Julie, is what do you all normally do for a search like this? I mean, do you normally provide both or one on demand?
Yes.
Yeah, so this is Mick, and I'll jump in here. So the position description, of course, is kind of the official document that describes the role. The prospectus is broader, just in general to incorporate the organization and the community into the fold, really to provide a full picture. And then taking one more step in liberty on the position description, taking time to describe the essential aspects of the role that is the expectation of the board, right? So it's taking it one step further of bringing life to what the role is and what the expectation is versus the requirements of the role. So that's the one additional step. So the prospectus should read more universal, where the position description is more focused on the requirements and expectations for just the role. Is that helpful? And we use the prospectus once we have candidates engaged in process. So we're talking to them at the same time we're providing them that information.
Is that you okay with that? All right. That makes sense. I mean, I think the thing that drew my attention to this is when I read the core responsibilities under the prospectus, I think that is, those are the things that the board wants the CEO to really focus on because they describe those things. They're replicated and they're certainly contained within the job description, but I really like the way they are articulated in the core responsibilities, but I understand the need for both and how you're going to use both of these at different points.
Right. Does that make sense to the rest of the members and any further explanation?
I think we're good on that.
All right.
Great. Those were the only areas within the documents that I was hoping to get consensus and approval on. So I will pass the baton on to Mick and Najam.
David, just addressing the timeline, we provided a cadence to the search, right? And through the use of this timeline, we can then overlay that to any conflicts that we might have. And again, I don't know that we need to get into that on this discussion today versus we wanted to provide that to you. Hear any feedback, potential conflicts, make adjustments to it before we meet and convene again. But if there's anything we need to address and talk about on the timeline, I'll leave that open to the committee.
Well, let's start with the question of, like, in general, we've seen the timeline, which lays out, by different category, culminating in what appears to be, a final selection meeting in sometime in June, and then various steps up until that point. Is there any sort of general problem with that timeline, or anyone in particular think this timeline is gonna pose a problem for you personally?
I'm just wondering if sort of the first defined date would be the candidate presentation meeting, and would just encourage us to establish that specific date as soon as feasible, because it is we're into late February now, and everything else after that is general and goes over a time period, but that one is going to be a really important.
I agree, and my assumption, Mick and Julie, would be that candidate presentation meeting would fall on one of our regularly scheduled meetings, because those meetings are on everyone's calendars for the next several months, and that we could do that even if we had to extend the time. That we at least have an hour and a half on our calendar set aside for that.
Yeah, that makes it easier for the group, right? If we do that, so we can plan on that. We'll identify that late March date to do that. We would likely come on site to present those candidates, as we've suggested before. So that would be one expectation there. We really, and this is of note to the committee and understanding, up until that point, a lot of this time frame is controlled on our end in the search process. Once we've introduced candidates and we get into interview, there's a lot of other factors that come into timing on those interviews. And so we'll try to stay in front of that as best we can, meaning that before we present candidates, we would like to have those first round interview dates identified and locked down. And this is important. If you remember, this is the big time commitment that I'm going to ask for from you as a search committee. This is where we're dedicating 90 minutes to 2 hours per candidate, and we're talking about interviewing 5 to 6 candidates, so 10 to 12 hours of time dedicated to those interviews, and we want to give you as much runway preparing for that to be able to set that time aside to do that appropriately. So I think before the next meeting, if we look at this timeline, we can identify any barriers to making the time frame work. We want to do that, and then once we confirm that those weeks will work, we'll start putting those dates, times on the calendars, anticipating that we're going to have 5 to 6 candidates to interview for first round interviews.
Okay, Mick, so one just logistics question that Ms. Lester just pointed out to me. The March 18 would be, as our meetings fall, the meeting that would be in mid to late March. Do you think that we could go ahead and target March 18th for that candidate presentation meeting, or is that too soon?
as I look at it being 30 days out, I think that might be too soon. We probably need to look at the next meeting.
Okay, so I guess we can put some like more specificity here. That would be April 1.
Yeah, I would be much more comfortable with that, and I would ask the team as well. Hasham, I don't know that we would be ready in 30 days to do that. I'd feel much more comfortable for an April 1st delivery.
Yeah, I agree. We've been in market. We can do what we can, but we also have prospects and candidates waiting on the prospectus to review as they move forward in the process. So I think that week and a half or 2 weeks buffer will make a difference.
I'm going to ask a question because I'm naive. If you've identified somebody that you think is a really good candidate, is there any reason that we can't go ahead and start the interview process before April 1st so that we don't have such a concentrated cluster?
If we had a candidate that we feel is at risk to losing them over timing issues, we will certainly bring that to the committee's attention. If we feel that's somebody that you would want to spend time with to be able to make a decision on them before they had to make a decision just over a timing factor, we would absolutely do that.
I guess I was also thinking of it from a efficiency and logistics standpoint. If you had a couple at this point that you think are really worthy of looking at closely, just go ahead and start the process for them.
We could. It'd be a bit of a deviation to our normal process. We're going to be in a position on this search, in a luxury position, to have a number of highly qualified candidates to vet and choose from. And what the expectation would be to present somewhere between 8 and 10 candidates to the search committee for you to decide which 5 to 6 that you're going to interview. And we won't lose, I don't believe we'll lose anything in the quality of that panel in the timeline that we're talking about. But if we felt you were going to miss something and risk something with a candidate that had a tighter timeline, we would not hold back information versus sharing it with you as a committee to decide. But I'm comfortable with the process and kind of the track record history of running this process. And honestly, as the candidates are looking at this, the right candidates will be available to you for the right reasons as well.
Okay.
So let me ask a question about the process of what that April 1st meeting will look like. And I guess I'll preface this by saying, if you all believe that you need from now to April 1 and that March 18th was too tight, we absolutely should do it during the time that you need. There's no need at this stage to rush. So, and if April 1st turns out not to be the right date and you need more time for whatever reason, please let us know. But I think it's helpful to have these dates in place. So assuming that this goes forward on April 1, this committee as a public body, whenever it deliberates, does so in an open meeting. And so if we are going to have a presentation of candidates and we are going to select from that slate a group to do first round interviews, that will be done in a public setting. Will the candidates, I guess 2 questions, will the candidates know that? And assume they will. And secondly, how do we conduct that in a way that is respects, to the extent we can, the privacy and sort of maintaining interest of people, given that type of sort of public deliberation that we need to do?
And that is a great question, right? And so I have sensitivity over protecting the confidentiality of candidates. It allows us to do the work that we do and be effective doing it. And so my suggestion for that is we would share information, accomplishments about the candidates, and we can refer to the candidates by number or letter. We can refer to them as candidates A through F. We can, 1 through 10, if we would like to do that. It doesn't diminish from what you as a committee will be provided as information and being able to make an informed decision, but it could protect the identity of the candidates, and more importantly, those that are not selected to move forward.
Right. Yes, Dr. Martin.
So
Just
some level of redaction on the candidates.
just to revisit a recurring question, which is, we have been told by our council that we can have closed session meetings for strategic planning, closed session meetings of this committee, and we might ask if this might qualify for strategic planning closed session meeting.
I will reconfirm, but one of our meetings this summer, we asked Metro Legal this question about what procedures can we use. I think the answer that we got, that we'll reconfirm, is that deliberations or any meeting that would involve discussion of selection of a CEO would be a stretch to say that it's strategic planning, and that generally those discussions are considered to be deliberations that require public. But we will do that. One question that I have that follows after that, though, is whether interviews fall into that category or not. I would think that we'll determine, in consultation with council, that an interview of a candidate is not a deliberation, so long as we are not deliberating. But if we are asking questions and getting information from anybody, including someone who wants to work here, that we're not deliberating. Now, but anyway, so I think that to me is a way where it wouldn't need to be an executive session. I guess maybe. All right, as I'm saying this out loud, I'm realizing that this is something on our agenda that we just need to understand how we're going to conduct that.
And
David, one other, category that I've heard is personnel decisions as well. That might be something to ask about if this relates to that.
Again, subject to we have asked this question because it's primary importance, and at least under Tennessee law, what we have been advised is that personnel decisions, hiring decisions, are not a category that is by itself exempt from open meetings laws.
Okay.
One thing that we would go ahead.
We would take an abundance of caution on redacting candidate information, just to make sure we can protect confidentiality until the appropriate time when we would share candidate information more publicly. And there'll be a time to do that. We just want to be careful of those that have no reason for that type of exposure.
I think one thing that we could ask for is that if you have 10 candidates, you forward those resumes to Janet Lester. She sends them to us individually. When they come up at the meeting, then they will have some redacted identifiers.
I would think, again, we'll confirm this. Like this is on our list to do, Mick, is to let you know how it is that we need to receive this. But I would think that that's possible. Again, because it's not a deliberation, it's information providing.
do I remember correctly that part of the process would be or could be one-on-one interviews with committee members and candidates that would not be public meetings?
That is always permissible, right? An individual board or committee member is not functioning in any group deliberative capacity at all, just one person.
I mean, I think early on, that is the plan that I understood, is that as many of us that, as available, would meet individually with the candidates. Then there might be an open thing for a smaller group. I don't know.
I think that's when we get to our finalists, like we envision, say, inviting 3 people for the very fulsome sort of series of meetings, that's wouldn't be feasible for the committee members to individually meet with like 12 people who are on an initial slate, but certainly at the end, that seems like a good way to proceed.
Yeah, your 3 finalists, there's no way to prevent information from being shared at that point, right? They will realize and know that they will be publicly announced as a finalist for the position. Up until then, we want to protect confidentiality as best we can.
Okay, well, while you are in this week 3 to 7 stage on our timeline, that will give us the time to make sure that we understand the mechanisms that we need to use and can use in order to conduct this process. But it does seem really important, especially at these early stages, not to lose potentially really good candidates because for good reason they don't want to be publicly identified as somebody who is at a very early stage of exploring new job opportunities. So we will figure out how to make that work as best as possible.
And holding the integrity of the organization and process intact, correct?
Yes.
Excellent. And again, do look over, so we'll identify April 1st as a presentation date. The first round interviews, again, that's going to be the big time commitment from the search committee. Expect to interview 5 to 6 candidates over the course of 2 to 3 days with a 10 to 12 hour time commitment over those days. So that's the big ask of your time. It'll get easier after that, but that's the big bulk of the work and the heavy lift from this search committee. So that's the weeks we want to really have you take a look at and make sure there's no conflicts or if there's mutually agreed upon dates that work best for the group.
Mick, I would ask on that you go ahead as soon as you are able to figure out what those blocks of time are, send those to Ms. Lester so that she can begin putting those as soon as possible on the committee members' calendars because getting this group together is difficult, and we are committed to do it because this is a critical function that we're doing and that the board has asked us to take the lead on. But the earlier that we can go ahead and just block those out and maybe even tell candidates, these are the blocks that we need you, the candidates are going to need to work with us on that because there's no other way to do it other than block a lot of time out as early as possible.
Yeah, and agreed. And getting them on the calendar now is a lot easier than trying to do it at a later date. So we'll work on that. We'll get that started today, if not no later than tomorrow, and we'll start providing some options.
I'd like to suggest that maybe that the members go ahead and submit to Janet known dates that they are out of town. Now, out of town doesn't necessarily mean unable to do a telephone interview, but if we could, I think we all already know dates in April, May, June that will be unavailable, and maybe it'll be helpful to go ahead and submit those.
And you can do telephone interviews 1-to-1. We just couldn't do that as a group.
Right. Well, I would say this, Lester, if you can, given that we have this April 1 date where we are planning to narrow a slate down to first round interviews, ask the members of the committee dates in April and first 2 weeks of May that they are not, could not participate, that would be helpful.
And is there a start time, end time? Are we talking during the business day or a business day into the evening?
So this is Mick, and the way I would envision it is if you're going to do these by phone or video, it provides more flexibility to doing that. If you were going to do these first round interviews face-to-face in person, then we would probably try to make those into a tighter time frame. So by doing them by video or phone to begin with provides a little bit more flexibility in scheduling. Julie and I do offer to mediate, to be involved in those interviews. And the structure of that interview, we've got it pretty well outlined for you, right? So it's kind of an easy process, right? So we've got a script, if you will, or a cadence to those interviews that will be very helpful to the search committee. But if we're going to do them video or phone, that provides us a little more flexibility in timing of those meetings.
Yeah.
So are you recommending that when we have this slate of 10 candidates that we potentially offer in-person or remote interviews?
Yeah, so that would be your choice, right? I think, and I have a preference. I prefer to have face-to-face on-site interviews anytime that we can. Of course, there's a cost associated with that, right, with candidate travel, the time commitment on the group. But you will get more out of a face-to-face meeting than you will out of a video meeting. But if we've learned anything after the pandemic, that we've become very efficient at running video meetings. So you can still get what you need out of that. Recommendation would always to be face-to-face on-site if you can do it. And if we default to video, I won't argue with that.
And one other thing, we can't have more than one board member, but in any of these interviews, do we want to include any other people, like representatives from Meharry, anybody else in town, anybody else that's currently affiliated with Metro Nashville General?
That's a good question. Ms. Smith, you want to talk about that?
Yeah, I think that at least what I'm seeing, Dr. Miller's second round interviews look like they include meetings with stakeholders and community tours and more of a social engagement. So if they make it past the first round, then that those people are included. I think this is just to get the applicant pool down. And I did actually want to ask the question, which I think you alluded to, which is, do you personally find virtual versus in person better? I will speak as someone who's interviewed hundreds of people at this point with my career path at Merrill Lynch. I in Wells Fargo, I tend to not like a virtual interview as much as I like it in person. I think the more you can interface with someone, the better. You will pick up subconsciously behaviors and just kind of a feeling, I think, that you will not get in a personal interview in a virtual interview. So that's my recommendation. I know it's a lot of work and I know it's a big time commitment. It's easier for us to walk in a conference room or close our office door and do an interview. But I also think from an intention perspective, for all included, it gives us the best focus and quite frankly, again, a better feel.
Who handles the cost of that?
Under our agreement, the hospital, over and above the engagement fee, like the fee for providing the service to them, we would pay the out-of-pocket costs for candidate travel. Is that right, Mick?
That is correct. Yes.
And I'll just ask the question again. Are we talking daytime before 5, or will this go into the evening? It really is important for scheduling for me.
Yeah, and I'll jump in here again. This is Mick, and I have had search committees that would dedicate typical business hours to this activity, but I have also conducted these interviews in the evening. I have also asked candidates to interview on Saturdays out of convenience for my search committees. So there is flexibility that we can build into that. The most important thing is identifying a comfortable time for you as search committee members to be able to conduct those interviews. I think that's the most important thing. I will ask for flexibility on my candidates' part.
Well, for me, the business day is preferable.
Well, when Ms. Lester gathers our availability, I think that would be important to note that, like, off times. Ms. Lester has also suggested to me, Mick, something for us to consider, which would be if we determine that we want to have candidates at this first stage meet one-on-one with various committees members, or many as available, we could structure that in a way that a candidate goes from room to room in that sense. So we could do it at one time. We don't need to separately schedule it, but committee members can be available. Also throw out whether you could do multiple candidates that way as well, so that it's the committee and multiple candidates are at a time, and we could make really effective use of time that way if we decide to conduct it that way. Okay, well, that's great progress. Thank you for the timeline. I think through our discussion, we actually have target dates in mind, and see the overall, but also increasingly specific structure here. We started out asking about sort of general reaction to the timeline, and I think we're all good with that. Mick and Julie, is there anything else that you need from the committee at this stage in terms of timeline and expectations for that?
No, I think the big thing is to determine if you're going to do first round interviews in person, which again would be my suggestion. And if we do that, to identify those in a tight time window of 2 to 3 days consecutively to get that done. So that's the other thing to consider if you choose to do that. Don't have to, just ideal if that is, if that's what we could do. It allows us to debrief, evaluate, and make decisions in a timely manner to be able to do that. So that's the other consideration, is the on-site versus virtual interviews for first round.
On that, I think you can assume our board chair has spoken in favor of that. You all prefer that. I think sort of not sensing any different opinion. So our preference would be to do them in person, but understanding that we want to be flexible for people who are not able to do that. And so I think you should hear from us that we agree with you that those first round interviews we would prefer to do in person.
Great. Perfect.
Wonderful.
We have the luxury of time and ability to do that, which is good.
Great. And let's we don't have to do it in the context of this meeting, but information from you to Ms. Lester about cost. I don't want to be insensitive to the fact that we are a public body and we don't have unlimited resources. There are some entities that conduct this search that may have that luxury. So let's understand before we do that what cost is associated with it, and just make sure that's consistent with what we have budgeted and what's appropriate for us to spend on that.
And that's good. We can do some work on this end to help identify what we feel would be the cost associated with that. We'll provide that to you in follow-up to this meeting.
Okay, yeah, that would be very helpful, an estimate, just to make sure that we've got, that is within what we have budgeted and envisioned for conducting this search.
Right.
I'm hopeful that we'll find dates when we can all be available for bringing multiple candidates in and maybe room to room, one-on-one. It is also possible if one, if all but one is available, but the other is available remotely, they could still do remote interviews during that time when we had multiple people in the building. Hopefully that's not necessary. And
You mean a committee member being remote?
Right.
Yes.
And I mean, one thing, this, I immediately think about residency interviews in medical schools, that we bring a lot of people in at the same time. Of course, we bring them all in, and they're all sitting at the table, and we talk to them. This would be different because I assume that you wouldn't want these people necessarily meeting each other.
No, it's going to be dedicated time for each candidate, correct?
Well, I hope, what are those residency interviews? Are you going to bring that same level of residency? I have envisioned the way we've described it as like a pressure cooker environment.
Yeah, I mean, with residency interviews, you bring in 25 people on the same day, and they all meet in a room, and a bunch of people come and talk to them, and then you have the private one-on-one interview. So this would have to be, we would have to use probably spaces here and over at Meharry, and have a way that people didn't run into each other.
Those residents have been to many institutions together anyway. Yeah. They know each other by the time they're done.
That's a little different.
Okay, it's going to be kinder, gentler, perhaps. Okay, great. Well, I think that brings us to the end of our business on our agenda, but Mick, Julie, and team, you tell us, are there other updates or things you want the committee to know before we adjourn?
No, just an overarching, we are in market, we are screening, identifying candidates, and then we will start to get into mine and Julie's interviews here shortly. So those are being scheduled. So that work is being done, but the same message from the last meeting is we've had what I would say from a volume, a tremendous response to the position, and we'll determine as we get into interviews as far as the quality of that response. But we're about to find out.
Very good. Any questions? Go ahead, Julie.
Oh, thank you. Quickly, just so with the revisions that are made to the documents, I will take care of those immediately. That said, are they approved and able to go be public?
Yeah. Since we do you want?
We need a vote.
I guess so.
Move to approve.
Motion and second to approve. Any discussion? Motion is to finalize the documents consistent with our discussion and deliberations during the meeting. All those in favor say aye. Aye. Any opposed? Motion carries. So, Julie, you have the official.
That includes posting, right? You said finalize the documents and post them, correct?
Yes, they are now. Once these revisions are made, they will be public documents, and we can now give those prospectus out to the candidates that we're in discussions with.
Yeah. Okay. So the committee has just formally voted to adopt or approve for publication those materials to go out.
Noted. Thank you.
All right. Very good. Is there a motion to adjourn?
So moved.
Motion second. We're adjourned. Thank you very much.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.